Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
Hi, Mary. What is the difference between excess cold and deficiency cold?
The inferiority of Yang will produce a deficiency cold as opposed to the superiority of Yin producing excess cold. Deficiency cold is different from excess cold. Excess cold cannot be relieved by warmth, but the deficiency cold can be relieved by warmth. For example, in daily life, you can see people having a common cold. Even though they wear a lot, they still feel cold. Very likely, they have contracted to excess cold. On the other hand, aged people, like your grandparents, usually wear a lot more than you and your children to keep warm. That is because aged people usually have Yang deficiency and the warmth can keep them from deficiency cold. Excess cold can also be associated with cold pain. This type of excess cold pain is usually sharp, and the patient does not like being pressed on the pain area, as pressing will aggravate the pain. For example, many women have huge pain before or during menstruation, and this type of pain is usually due to excess cold accumulated in the uterus. On the contrary, people having deficiency cold like to be pressed, as pressing relieves the pain, making the patient feel better. Excess cold is the superposition of excess syndrome and the cold syndrome, and the deficiency cold is the superposition of deficiency syndrome and the cold syndrome. Therefore, other than the two major differences mentioned above, you can see the accompanying symptoms are different. Excess cold syndrome is cold syndrome accompanying excess type of symptoms, such as high fever, loud voice, and forceful pulse. And the deficiency cold syndrome is cold syndrome accompanying deficiency type of symptoms, such as low fever, feverish sensation, feeble voice, weak pulse, etc. The strategy is to identify the excess and the cold syndrome separately and then put them together, just like you do math. 1 + 1 = 2. You get your conclusion of excess cold syndrome. The same logic goes for deficiency cold syndrome. From the patient's clinical manifestations, you find deficiency syndrome and cold syndrome. Put them together, that is deficiency cold syndrome. The treatment principle for solving deficiency cold is to increase the body's yang qi. Patients with Yang deficiency generally have cold bodies and hypofunction of zangfu organs. The treatment principle for excess cold is to expel it out of the body. If you find this video is helpful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!